Building a predictive model for sepsis mortality, first day data. Sepsis is a clinical syndrome that has physiologic, biologic, and biochemical abnormalities caused by a dysregulated inflammatory response to infection. It occurs in 2% of all hospital admissions and accounts for 10% of all ICU admissions. Sequential organ failure assessment score sequentially collects data in the ICU and is used to prognosticate. It predicts death in the hospital with an area under the receiver operating characteristic curve of 0.753. The objective of this study was to build a predictive model of sepsis mortality similar to SOFA using only data collected on the first day in the ICU. The cohort was selected from the MIMIC database, which is a database containing approximately 50,000 unique admissions to the Beth Israel Deaconess Medical Center. The outcome was hospital expiration, and patients with sepsis were included if they were age greater than 16 and if they spent at least 4 hours in the ICU. The features that were selected included gender, ethnicity, age, physiologic factors, laboratory factors, and clinical factors, including comorbidity, which is measured by the Elix-Hauser comorbidity score. The model was built using gradient-boosted trees. An initial model was built using 55 of the predictors, with an area under the receiver operating characteristic curve of 0.6912. A 1,000-iteration random search through the hyperparameter space was then carried out, followed by 5-fold cross-validation to select the number of iterations for final training. A final model achieved an area under the receiver operating characteristic curve of 0.7463 in a test set that was never seen by the training model. These are the features that were identified as important. Comorbidity leads the pack. In conclusion, we built a model that is quite similar to SOFA, but uses data only collected on the first day.